like to welcome all of our viewers, and we thank you as always for joining us. And we'd also like to welcome our guest. We have Dr. Dawn Hornberger joining us today. She is an optometrist, a low vision specialist, and a longtime friend of Vision Resource Center. My name is Mark Levengood. I'm the counselor at the Vision Resource Center. And our topic for you today, since October is actually Blindness Awareness Month, we're going to be addressing 5 common eye conditions for the visually impaired. Today is actually part 1 of a 2-part series. Part 2 will be next month. But in today's part 1, we're hoping to address macular degeneration, glaucoma, retinitis pigmentosa, diabetic retinopathy, and corneal diseases in part 1. So, Dawn, good morning. How are you today?
Good morning. I'm good. Thanks for having me.
Yep. Thank you for joining us. So, Dawn, how long have you been working with the visually impaired community, and in what capacities?
I actually have been an optometrist for 31 years and a low vision specialist. I have a master's degree in vision rehabilitation in addition to my optometry doctorate. And I have been working in the Berks County community since 1989, so all those 31 years. I have 2 offices of my own, one in Birdsboro, one in Warnersville, and I'm also the low vision specialist at Eye Consultants of Pennsylvania in Wyomissing.
Excellent. So clearly a lot of wisdom.
I hope so. I don't know.
And how long would you say roughly you've been affiliated with the Vision Resource Center?
I'm thinking it's close to 20 years. I don't have an exact number, but I've been on the board on and off through several administrations of the agency. So it's been quite some time.
Absolutely. Longtime friend, like I said. So why don't we get started with macular degeneration, Dawn? If you could just share with us, what is it and what causes it?
Macular degeneration is a very common condition that affects people as they get older. There are actually forms of it that affect younger people, but the most commonly sort of referred to, or the most common experience with people is as they get older, the age-related form. So with again, we could go into lots of details about other forms, but the one that would be most common is the age-related form. So clearly then age is probably the primary factor.
Right.
There are some people who do have a family history. There are some strong family tendencies. Circulatory problems also contribute. Smoking is probably one of the biggest contributors to putting you at risk for macular degeneration. So those are the things that are out there. Nutrition, exercise, again, anything that affects circulation. It essentially is a disease that is caused by poor circulation to the central part of the retina, which is called the macula.
Okay.
And as we get older, the circulation gets worse.
Sure. Yeah, and then anything we do to hinder that circulation, it's just going to promote it. So what then are some symptoms that people with macular degeneration experience?
Typically in the early stages, someone may find that they just aren't seeing as clearly. Sometimes things will become distorted. You may find that a straight line is wavy. You may find that there are missing pieces in the vision, like you might be reading a word and one of the letters disappears. It varies. It sometimes depends whether it's the dry or the wet form.
Okay.
There are 2 different forms.
Okay. So is there any form of preventative measure that people can take to avoid macular degeneration? And if they are diagnosed with it, is there any treatment method for it?
Yes. The biggest thing is, again, smoking. If you are smoking, you need to stop. If you don't smoke, don't do it. That's one of the biggest things that you have control over. Dietary factors are also a big thing. There are certain vitamins that are known to be helpful. There was a big study called the ARIDS study, Age-Related Eye Disease Study number 2 is actually the one that we're using. The results from that have been formulated into a vitamin that's very helpful in preventing progression of the disease. There has been some feeling that a product called lutein and something called zeaxanthin and some of the other products that are in that family may be helpful in prevention as well. so that there's a number of different things that are actually known to be helpful as far as dietary or supplements.
Okay.
Anything that improves circulation. So making sure if you do have diabetes or heart disease or high blood pressure or any kind of circulatory issues, that they're being managed by your primary care physician or your cardiologist or other physicians as well as they can be managed. And also keeping active, making sure that you're continuing an active lifestyle. Anything that improves circulation is helpful.
Sure.
And also staying away from UV light. Having a good pair of protective UV sunglasses is probably the other thing that you have control over. Okay.
And then for those who do develop macular degeneration, is there any treatment for it?
Unfortunately, the dry form, there is no significant treatment for that at this point, other than doing the vitamins and again, maintaining those other things we just talked about. For the wet form, however, that's when there's actual bleeding or fluid that occurs in the retina. There are some injectable medications that will help to reabsorb that fluid or inhibit the growth of the blood vessels that promote that. So yes, there are some injectable treatments that are being done now. Occasionally laser treatments. In the past, laser treatments were sort of the standard of care. Now it's more the injections that are in favor.
Okay. All right. So then moving on to the next eye condition with glaucoma. What is glaucoma? And again, what causes it?
And again, glaucoma, there's a variety of different forms of glaucoma. Basically, in general, they are a disease of the optic nerve that in some cases is caused by high eye pressure. That would be the most common form, would be when the eye pressure is high, although there is a form called low pressure glaucoma or low tension glaucoma, where pressure never really exceeds what would be considered normal. And then there's also something called narrow angle glaucoma, where just the fluid chamber inside the eye where the fluid builds up, the drainage that goes out of it is actually too narrow and fluid builds up. And then there are different treatments depending on which form of glaucoma it is.
Okay. And then what are some common symptoms of glaucoma?
The most common thing is that there are none. That's the frustration with glaucoma. The typical person who says, oh, I don't need to go to the eye doctor because I see fine. That's the person who's at great risk. Okay. Very interesting. So for someone who thinks there is nothing wrong, they're susceptible. Yes. Sometimes people will have glare around lights or halos, but that's usually only if the pressure is very, very high. In the stages where it's most treatable, there really aren't any symptoms that would be detectable. And if we can catch it at that stage, it's a very treatable condition. It's just we can't fix the damage once it's there. Sure. So along those lines of treatment as well as prevention, is there anything people can do to prevent developing glaucoma? And then again, like you started to talk about with the treatment. Prevention really it centers around early detection. There are very little there is very little that you can do as far as any kind of supplementation or exercises, or really there's not a lot we can tell people to do as a preventative. Just get to the eye doctor. I'm sorry? Just get to the eye doctor and catch it early. Yeah, get to the eye doctor. Yeah, I mean, having regular exams is really the way to prevent damage from glaucoma, because if it's detected, it is very treatable. And typically the treatment would involve either eye drops with a medicine in them, or there are laser procedures. There are a variety of different surgical techniques. There's a lot of treatment out there. It's just a matter of getting to the person before the damage happens. Okay. So then moving on to our next eye condition, retinitis pigmentosa, often just referred to as RP. Dawn, if you could share with us what is RP and what causes RP? RP is basically, again, a range of different conditions. There are a lot of different causes. Many of them are hereditary, and there's also very, very different ways that it can be inherited. But by and large, it's something that's a genetic condition that basically causes loss of the retinal pigment epithelium or damage to it, which is one of the layers of the retina. When we look inside the eye, what we see is these pigment clumps. And it starts out peripherally in the side areas of the retina, and then it gradually works its way inward. So it can be a very devastating loss of vision in the person that has it.
So in that regard, this and macular degeneration are kind of the opposite. Macular, you lose your central and it works its way to the peripheral. And with RP, you lose your peripheral and it works its way in.
Yes, yeah, exactly. And with macular degeneration, for example, you never completely lose vision because it only affects the small area in the center of the vision. However, with RP, there are people who will progress to losing the vision completely or almost completely, although it can be very variable. I have patients who are in their 70s and 80s and still maintain some usable central vision. It's not a guarantee, depending on the inheritance pattern and just the form of RP. Some of them are very quickly progressive that you start in your teenage years and by the time you're 20 or 25, 30, you may have lost the vision almost completely. And others, people maintain vision well into their elderly years and have usable vision. So it really is a variable condition.
Got it. So what are some of these symptoms? I know we talked about like a developing tunnel vision, but any other symptoms?
Often light sensitivity or difficulty with night vision is the first thing. Because RP affects the part of the retina that is primarily responsible for night vision initially, that is sort of the first thing, is that you might have a lot of difficulty when it's dark.
Okay. Now, I know you said RP is often genetic, but is there anything people can do to prevent it or, once they have it, to treat it?
Unfortunately, not a lot, because it's hereditary. Other than right now, actually, I'll step back. There are some gene therapies that are being worked on and are being done. They're fairly new. Their success rate is sort of not the greatest. Sometimes they can get people to be able to see objects if they've completely lost vision, just to be able to basically have some mobility. But as far as getting back their normal vision again, no, there is no treatment for that. And there's really not a lot you can do because it's hereditary.
Sure. So then looking to the next eye condition we're going to address today with diabetic retinopathy. Could you explain what it is and then what causes it?
Diabetic retinopathy is a problem that occurs in diabetes. So if you don't get it unless you have diabetes, and the longer you're diabetic and the less poorly controlled or the less well controlled you are, the more of a problem that can present. So most people who are type 1 diabetics are a little bit more prone to it, although it can happen in type 2 diabetes as well. But it's basically this process happens throughout the body in diabetics, that when you're diabetic, the blood vessels become leaky. And when that blood leaks out of the vessels, number one, it's not getting where it's supposed to go, but also as that blood leaks out, it causes damage to the tissue that it's leaking into. So that can happen in your heart, in your kidneys, and, pretty much almost any organ of the body it can happen to. But primarily it happens in the retina, which is the lining of the eye, and then it causes scar tissue and can cause complete loss of vision if it's not treated.
Got it. And so what are the common symptoms for those who struggle with diabetic retinopathy?
Well, in the initial stages, you may not have any. Depending on where the bleeding is happening, you may not know it's happening, which is, again, why it's really important for diabetics to have at least once a year an eye exam, because if it's caught in the early stages, that's when it's most treatable. But in the later stages, you do notice loss of vision. You'll find that you can't see properly. You may have blind spots in the vision. If it's really bad, somebody may come in with feeling like there's red in the vision, which is actually the blood. But for the most part, blurred vision would be a symptom. You may develop fluid in the retina that causes loss of vision, and then you might have a feeling like you're looking through water or just cloudy vision. But the key is that if you can get in regularly, hopefully we can catch it in the early stages, get the diabetes under better control, and also then there are treatments available for it.
Okay. So again, looking to the treatment as well as prevention, what can people do to keep from developing this? And then if they do get it, then what?
Well, the biggest way to be preventing it is either not to get diabetes in the first place, which
Sure.
type 1, you don't have a lot of control about that. That's something that
Sure.
is something that is sort of linked to heredity as well as to
Sure.
to environmental factors. But the type 2 diabetes is largely linked to obesity. So,
Okay.
maintaining, good body weight, making sure you're eating healthy, exercising, all of that certainly helps. If you are diagnosed with diabetes or pre-diabetes, doing everything you can to monitor your diet and also use the proper medications, make sure you're being as aggressively treated as you need to be. I find a lot of times in this area, because diabetes is so prevalent, people don't take it very seriously, and
Right.
they wait until it's really out of control to do anything about it. And the studies have shown that probably about 10 years prior to diagnosis is many times where the damage happens, that
Okay.
people who are in that pre-diabetic stage where they're just a little bit off on their sugar levels, those are the people who really we're trying to mark as the people you want to go after more aggressively, because if you can control the sugar, you can prevent a lot of this problem from happening in the first place.
And then you can focus on the treatment of it before it gets too evolved.
Yes. And so that's the biggest thing. Now, as from an eye treatment standpoint, if once you actually have diabetic retinopathy, the key is that if there are these areas of bleeding or fluid, the medicine that works for the macular degeneration that's injected in the eye also is often helpful for that. So there are these injectable medicines, there are laser treatments. Sometimes they literally have to sacrifice your peripheral retina by lasering it to sort of preserve the central retina. So there's a lot of treatment options out there. But again, the key is prevention and early detection.
Okay. And then, Dawn, moving to our last eye condition for today, could you talk about corneal diseases in terms of, what are they, and again, what causes them?
Well, corneal diseases, there's lots of them. So there are a number of them that are hereditary. There are different dystrophies that basically just come because you inherit it from someone. So those, obviously, there's not a lot you can do to prevent.
Sure.
One of the biggest reasons that somebody needs to have a corneal transplant is herpes virus infections. And herpes virus is, in the class of like your chicken pox, which is the herpes zoster or shingles, are all caused by that. And the herpes simplex virus is the one that causes cold sores. So those are the two. There's also genital herpes. So, those are not as much associated with the corneal diseases. Mostly it's the herpes simplex and the zoster that cause the issues. But and the simplex actually being the more difficult one as it relates to the cornea. But those diseases basically cause an infection in the cornea, and if it's not caught and treated right away, it can lead to scar tissue, and that scar tissue can permanently damage the vision and often need a transplant to be able to see better.
Yeah. So what would be symptoms for people struggling through that?
Basically just any time that you have a red eye, people often say, I have pink eye. I'm just going to go and call in and have somebody call in an antibiotic for me because I have pink eye. Well, this is the reason why, patients often get frustrated when we say, you know what, I really want you to come in. I want to know what's causing that pink eye, because if it's a purely bacterial conjunctivitis, conjunctiva is the clear membrane over the white part of the eye, and anything that inflames that can cause it to become red. So you can have allergies that cause a pink eye, or you can have a bacterial infection, or you can have one of these viral infections. And right now, actually, COVID can cause a conjunctivitis. So, it's one of those things you just don't know what's causing it. And the only way to know, is it a virus? Is it allergies? Is it just something affecting the conjunctiva? Or has it actually affected the cornea? Because you wouldn't see that without a microscope. So when someone goes to a primary care physician and gets treated for pink eye, really, they don't have the equipment to look at you. They don't have a microscope. They don't know. And sometimes what people will do is they'll say, my eye doctor gave me this eye drop once for pink eye. And so I'm going to just use it. Well, for example, if the eye drop has a steroid in it, steroids are used very specifically for very specific things that can actually make the herpes virus grow. So, it's really a dangerous thing to use something in your cabinet without checking with an eye doctor.
Right.
Really, eye doctors are where you need to go for eye problems. So, we have the equipment to look, we have the way to know, is this in fact the problem? And in our area, we have so many eye doctors that have on-call services that it really is not necessary for somebody to ignore something if they're having a problem. Cornea diseases, though, they can be very varied. I mean, contact lens complications are another big thing. People who are over-wearing contact lenses, people who are not going for regular checkups with their contact lenses, people who don't change their solutions properly, people who sleep in their contacts. There's so many things that can happen to the cornea as a result of contact lens wear. And if you're following the proper protocols, if you're going for regular checkups, that's why we say, we really can't refill a prescription beyond a year
Right.
in most cases because of that.
Yeah. Okay. So then it sounds like for prevention and treatment, well, at least for prevention, it's, if you do have a red eye or pink eye, it sounds like don't blow it off, don't overlook it, and like actually go to your eye doctor.
Yeah. That would be what I would say anyway.
Yeah. And then for treatment, it sounds like there are actually a fair amount of treatments depending on when you catch it.
Yeah, it depends on what's wrong. I mean, if it is an infection, again, we can prescribe antivirals, we can prescribe antibiotics, we can prescribe steroids if need be for different inflammatory conditions of the cornea. There are, a variety of different treatments that way, but,
Right.
once the damage is there are a variety of different either partial or complete corneal transplants that are available. The cornea is one of the few parts of the eye that are actually transplantable, that you can take a donor cornea or you can take just pieces of a cornea, and there are a variety of very complicated procedures that the cornea specialists do where they just take a specific layer of the cornea and replace it.
Okay.
Or even artificial corneas that have been designed.
Awesome. So then, Dawn, just as a wrap up for today, obviously there are a number of different reasons a person could lose their vision. We tried to address as many of them today as we can in part one of this program, but what would be your overall recommendation for people to protect their eyes and to preserve their vision?
Well, the things that we talk about for everything else for your health, good nutrition, exercise, protecting yourself from UV light with good quality sunglasses, making sure that they are protecting you from both the UVA and B wavelengths of light. Being seen by an eye doctor on a regular basis, you can't argue with how much prevention. Doing things at their earliest stages are really, really the most important thing.
Okay, excellent. Well, Dawn, thank you so much for joining us this morning and giving us your time as well as your professional expertise on these areas.
Thanks, Mark.
Yep, and just as I said earlier for our viewers, today is part one. We're going to follow this up in November, doing a part two. Dawn has graciously agreed to come back and cover part two with us in November. And so next month, we're hoping to address issues like color blindness, detached retinas, cataracts, and even vision loss as a result of strokes, traumatic brain injury, and brain tumors. So, Dawn, we definitely look forward to having you again next month to do part two.
Thank you.
Thank you. And to our viewers, we do hope that you enjoyed our program today, found it informative and educational. We certainly all hope that none of you develop these conditions at any point in time. But if you do, now you can at least go in fully aware, knowledgeable what's happening. So thank you for joining us. Just so everyone is aware, in a couple weeks, we have our monthly virtual sight loss support group coming up via Zoom on October 28th. So if anyone wants to attend that, just call me, Mark Levingood, at 610-375-8407, extension 120. And with that, we thank you for joining us today. Hope you have a great day, a great month, and we hope to see you in November for part two.